we always clean for health. The normal kind of rules of engagement as regards how clean a building is, they've changed now from kind of early this year onwards. We would have seen this as our job always up to now. So for us, there's not a big difference in us trying to prevent the spread of infection of COVID in a building as opposed to the spread of the common cold or the winter flu or, you know, all of that stuff. But it has taken on a very significant part of every other business's operations going forward. So we're very fortunate to be in a position to be able to assist with things like this and to share the knowledge that we've built up over the years. So that's probably as much of a background as I can give. If that's okay, Margaret, to go ahead. Do you want me to wait another wee minute till we make sure, is there anybody else on, or? Here, I can unmute you again, Margaret, a wee second.
Go ahead. Yeah.
Go ahead. Perfect.
Yeah, thanks.
Grand. I'll just share my screen with you now. Just take a wee second. And you are recording this already, John? Yeah. Perfect. Okay, so there is quite a bit to get through in this. I know John and Margaret have asked that any questions, shoot them into the comments, and obviously if there's something specific, you guys can unmute yourself, or John and Margaret unmute yourself and actually stop me, because I go at 1,000,000 miles an hour sometimes to try and get through this information. But this particular webinar is regarding community settings, so it's very specific to the type of environments that you guys are going to be reopening now shortly. And obviously it's brought to you by the Volunteer Centre and the Donegal Local Development Company are the partners on this one. So just to give you an idea of what we're hoping that we will have time, and we will have time to get through all this stuff today, sorry. By the end of this, you should have a very clear understanding of the key infection prevention requirements under your return to work safely protocol, and understanding what COVID-19 and the infection risk that it causes for your community setting. We look at reducing the risk within your specific facility. We look at the different cleaning and cleanliness standards. We look at understanding disinfection chemicals and why it matters what you use and how important it is that we manage that chemical piece correctly. Dealing with a suspected case of COVID-19 in your facility and what kind of procedures you need to put in place around that. And then obviously staff training. So if you're responsible for training anybody that comes into your building, whether it's staff or the users of your facility, we look at that piece as well. What I would say is these slides are a bit text heavy. We've tried to condense down the vast amount of information that came on the protocol document. We've tried to distill it down into pieces that are actually relevant for you. I will issue these slides to Margaret to send out after, so you don't need to be worrying about taking down a pile of notes. We'll actually give you these as well, so that you can go back on them. And obviously if you have any questions, don't be afraid to reach out. So what are your key requirements under the Return to Work Safely protocol? The Return to Work Safely protocol is it's a joint framework basically between the Health Safety Authority, the Health Service Executive and the Public Health Department within the Department of Health. And it's a framework for reopening safely. And this it's a broad guidance document that covers every sector, every industry. And by its very nature, the language in it is quite vague in order to encompass all of those different industries. So it's, I suppose the challenge for businesses is to try and distill that 27 or 28 page document down into a relevant piece of information for your business, or what bits of it are relevant to your business. So hopefully we'll be able to do that for you today. And the purpose of it is to allow businesses to reopen safely within a very clear framework for employers and employees. There's an oversight and enforcement function there with the Health and Safety Authority. And again, the Health and Safety Authority's remit on this falls under their current Health and Safety Welfare at Work Act. So they do actually have quite a robust enforcement authority on this particular piece of legislation. no different to they would have on the existing legislation, and their commitment to actually ensuring that they hold responsibility for this has been very evident in the fact that they've put 500 extra enforcement officers on the ground within the last number of weeks. And what that means in reality is that as businesses and organisations are opening, they are going in and checking, do businesses have a COVID response plan in place? Have the staff been trained? Were they given induction prior to returning to work? You know, all of this type of thing, they're actually checking. So in one regard, it's probably putting a lot more pressure on businesses to get this done prior to opening because of that you know, requirement that they could land in at any point. From an infection prevention point of view, that's something I'm delighted to see, that it is actually going to be very robustly checked and stuff, and that will obviously help to keep the infection rates down, because the steps that they're asking us to take are actually very necessary and required. What I would say is that it does identify a shared responsibility to work safely, to ensure that these infection rates stay low. So, you know, while the onus is inevitably put on the organisation through something like this, particularly when it falls under health and safety legislation, it's up to us as organisations to make sure that we take full responsibility for enforcing all of the protocol. But it does identify out that there's a shared responsibility, that staff do have their part to play and that clients have their part to play as well. So users of your facility are obliged to abide by the necessary precautions that you put in place. And we look a wee bit more at how we deal with that in practical terms when we go forward. But inevitably, it's up to us to show leadership to our teams, to our clients, and to instill confidence in people using our facility that we're taking it seriously and that we have the health and welfare of our users, our staff, and ultimately anyone within the building or within the facility. It's up to us to make sure that we kind of raise the flag and say this is the standard that we want to maintain within our building. And we will expect everyone that comes into the building to maintain the same standards as well. So your key requirements under the protocol. So every organisation must appoint at least one lead worker to assist in the delivery of COVID-19 requirements within the business. Now this is in addition to the manager or the owner of the organisation as such. I suppose the challenge within a community organisation is who takes responsibility for this if it's a group of volunteers. And again, that's something that I suppose maybe the DLDC and the volunteer centre can assist with, maybe helping to identify that person within each organisation. But there must be one lead worker to assist, and we would always recommend that this be someone other than the business owner. It's a fairly large piece of work that needs to be done. And what you don't want is a situation where only one person within the organisation has all this information, because in the event that that person becomes unwell or that person is off for some particular reason and that knowledge goes with them, your organisation is left very open then in that situation. So it's preferable to have at least one along with the business owner. We're also required to develop a COVID response plan. Now these documents are all available. The templates for these documents are all available on the Health and Safety Authority's website. And again, we can link these, if you haven't already got them, we can link them along with the slides that we're going to send to Margaret later on. Then we are responsible for reviewing and amending all the existing occupational safety and health policies and procedures. So well, I've seen this done in a number of ways. If you already have a health and safety document, what some organisations have done is they've taken each section of their safety statement, essentially, and they've added in the COVID related information to each section. Other people have taken a different approach and they've developed a COVID occupational safety and health policy. It's, I suppose, whatever's practical for your particular business. Within our own businesses, we have developed a new safety statement that includes all of the COVID stuff in it. But there are other options. You don't need to reinvent the wheel. If you have a safety statement there, you can look at putting these health and safety elements or the sections within your health and safety statement and adding in the COVID information that's required to those sections rather than rewriting the whole thing. We're also required to implement COVID-19 prevention and control measures. And they've basically made this very straightforward and very succinct for us. The key ones that they've asked for are a pre-return to work questionnaire for all staff, and that must be issued 3 days before they come back to work, and induction training for all staff on return to work. The vast majority of companies that we're working with at the minute are doing all of this stuff online. They're not necessarily waiting until people come back into the building to do this training. Ideally, people would be well aware of what the new processes and procedures are before they come into your building, so that the risk is completely mitigated before they come in. Then induction training for all staff, contractors and visitors. And again, if it's a case that you have people coming to your building for the first time, that maybe they're not necessarily there all the time. So you could have, within your normal community group setting, you're going to have people using your hall, you're going to have people coming in for different functions or whatever is on. Obviously our indoor numbers are going to be a bit limited for a while, but delivery drivers, all of that sort of stuff, you've got to look and see who do you actually need to take through the new processes within your business and within your setup. So we'll talk about that in a wee while as well. Complete a risk assessment, and this is specifically to include infection prevention. Your risk assessment for your business under health and safety policies would already be done. So the type of activities and all of that sort of stuff under your current health and safety statement, the normal risks would still be there. But what they're specifically asking for in this document is they want something for you to be able to identify where the infection risks sit within your organization, and to supply all facilities and consumables identified in the control measures of your risk assessment. So for example, if one of the risks is that people may contract it from fomite transmission on door handles or lift buttons, etc., and the mitigation step there is to put in hand sanitizers, then you must supply those hand sanitizers. That's kind of the line that they're going down with that. And again, we'll go into these in more depth shortly. We're responsible for implementing a cleaning program and identifying high risk surfaces. Now, again, there's nothing within the guidance to say that the cleaning that happens already isn't sufficient. They're asking us to look at the cleaning program itself, identify what surfaces are touched most frequently, which of those surfaces are likely to be most contaminated, and to clean those high risk contaminated surfaces more often. So while, you know, somebody may come in at the end of the day and do a clean around the building, that's sufficient in the cleaning terms. It's the disinfection step that maybe we need to add in. So there's no stipulation there that you have to hire in additional cleaning help or anything like that. That's not what it's about. It's making sure that the cleaning that's carried out on site is sufficient to mitigate the risk, and also that people that are, I suppose, responsible for doing that particular cleaning function, that they know the risks and they know how to carry out cleaning and disinfection processes correctly, so that they can eliminate the risk within your building. And then obviously to maintain physical distancing measured as identified within the risk assessment. And we'll go through kind of how we can try and engineer out a lot of these problems as we move forward as well. So I want to just run through quickly COVID-19 itself, what the kind of signs and symptoms and stuff are, and how does the disease actually spread within a built environment, and then so that we can help understand and identify the risks within any specific building. So COVID-19 is a new disease or novel disease that was caused by the virus SARS-CoV-2. It's a coronavirus that can affect your lungs, airways, and again, in more recent studies, they're becoming more aware that it actually has a vascular element to this virus as well, which accounts for the 20% of people who have significantly worse symptoms than the milder cases. Common symptoms from the milder cases are things like high fever, cough, and shortness of breath. Obviously, it gets more complicated with the 20% that have more serious symptoms. 80%, as I've said, is mild to moderate, and 20% would require hospitalization and severe to fatal outcomes in some circumstances. Symptomatic people appear to be the most infectious to others when they're in the early stages of the disease. Now, because this particular virus causes a challenge from the perspective that not all symptomatic for 3, 4, maybe 5 days and not even have any symptoms. Symptomatic people can be shedding the virus for 2 days before they show symptoms. So that's quite challenging from the management of the risk perspective, is that we can't see it. We can't see people who are sick. If somebody comes into our building and they have the flu or they have the common cold, you can identify those people because they look sick. Whereas in this circumstance, it's a wee bit more difficult because we can't see. So in that sense, the visual symptomatic person is not present, and it's much more difficult to actually, I suppose, manage that risk. And it means that we must consider the routes of transmission, and we must eliminate it at that point. And I'll explain what that means now in a second. So as well as that, because it's a new disease, then the information and the symptoms that are being identified kind of change quite regularly. And there's been a few updates in that over the last number of weeks, particularly around the vascular element of this. So it's important from your perspective to keep your organisation up to date with the most recent guidance from the Health and Safety Executive or the Health Protection Surveillance Centre, the HPSC. They have some really good guidance, particularly any of you who are involved. If there's any kind of childcare facility within your community setting or you're dealing with children, the HPSC website is a very useful one. And again, I'll link their guidance as well to Margaret, so that you have that in case you need it. So the chain of infection for any disease, really, it's not specific to COVID-19, but this kind of chain of infection would be standard for most infectious diseases. The two that we're going to concentrate on are the portals of entry and the modes of transmission, because this is what we can control with this particular disease. And when we say the modes of transmission, it's how the virus is actually spread. So we've two main means that we can have control over, and that's respiratory secretions and the fomite route. So respiratory secretions are not necessarily just coughing and sneezing. A lot of people think it's, you have to be standing in front of somebody and they sneeze or they cough on you. That's not the case at all. Respiratory secretions are present in our breath, and standing in close proximity, a metre away from somebody or even 2 meters away from somebody for 15 minutes is enough respiratory secretion to actually give you COVID-19. So in that sense, we have to be careful of the respiratory secretion myth that it's not just sneezing and coughing. If I'm sitting at my laptop here, for example, and I'm sitting here for an hour, there's absolutely no uncertain terms that laptop is contaminated by the time this hour is up. It's that type of normal everyday situation that can cause a risk. So we have to be mindful of where do those respiratory secretions fall. They don't have, it's not aerosolized, so it doesn't hang around in the air for a very prolonged period of time. There has been lots of evidence to show that it can be still there within 2 to 3 hours of somebody, for example, coughing, but the normal breath respiratory secretions would pretty much fall out of the air and onto the surfaces and onto the floor within maybe an hour at the most. So the high risk is gone at that stage. But it does fall onto surfaces, which is our second route of transmission. And the fomite route is essentially where my hands touch my laptop, which is now contaminated, and my hands go back into my mouth. And that's probably the easiest way that I have to explain it. We also have my hands touching other surfaces, and then other people come and touch those surfaces, and that transmits from one person to another. So there's a couple of different ways that we can control the spread. Because they're through respiratory secretion and touching contaminated surfaces, the three main strategies we have for reducing infection risk are effective hand and respiratory hygiene. So obviously hand hygiene is self-explanatory. We either wash or we hand sanitize. Respiratory hygiene is our coughing and sneezing and things like our making sure we're not, socially too close to people and stuff like that. Physical distancing obviously is the second one. and then effective surface cleaning and disinfection. We believe that's the last line of defense. You know, you want to have a situation where you're kind of doing the first two automatically all the time. Every time you have the opportunity to hand hygiene, every time you're going to eat, if you change risk areas from one building to another, or from outside to inside, or, you know, you've gone shopping, all of that stuff creates an element of risk change. And at those change points, we need to think about washing our hands. Every single time you come inside, we should be washing hands. I'll not preach on anymore about that. But once all that stuff's in place, that eliminates a big piece of the risk. And then the last line of defense we have then is obviously surface cleaning and disinfection, and making sure that we also knock out the infection risk from the fomite transmission as well. So just to give you an idea of how long COVID actually lasts on different surfaces. So this information was taken from GBAC, which is a Global Biohazard Advisory Council, back in March of this year. It doesn't survive very well on paper. So if somebody coughs or sneezes onto a piece of paper, once it's dry, the virus effectively inactivates on paper. So it's not something to be concerned about in, you know, for having books around and stuff like that. It's not a big issue. What we would be concerned about, obviously, is if there's anything there that's laminated, that has plastic covering on it and stuff like that. It's just to be mindful that it does last longer on those types of surfaces. Over 24 hours on glass and metal, 48 hours on plastic surfaces, 60 hours in soil or water. So again, think about your outdoor areas, your, you know, pitches, that type of thing. More than 7 days in respiratory secretions at room temperature. So again, we're talking about, these are kind of more lab orientated survival times. I don't know of respiratory secretions that last 7 days anywhere outside a clinical setting, but just to kind of give you an idea of how long the virus can survive in certain circumstances. The problem with the built environment is, for much of us, or like the major components of our built environment are plastics, metal and glass. And those particular surfaces take up or make up a fair portion of most new and modern buildings today. You know, when we look at things like, you know, our tables and our countertops and kitchen counters and fridge handles and door handles and, you know, all of that sort of stuff, our entryways in and out, all of these busier pieces of our building essentially have the potential, if they're infected, to stay infected for 48 hours, or between 24 and 48 hours before the virus becomes inactive. So this is why we need to make sure that cleaning happens regularly, to ensure that we reduce that risk from 48 hours to, well, it's cleaned twice a day. So it's cleaned, and we're shut for 8 hours a day. So if we're shut for 8 hours a day, that's only 16 hours left. And if we clean it twice a day, then the risk is only 8 hours instead of 24, that type of thing. So we need to look at how we clean, when we clean, how often we clean, and the surface that we're cleaning would be relevant there as well. So if it's glass, metal or plastic, obviously the cleaning frequency needs to go up. So with regard to the risk assessment, the kind of questions that you need to be asking from a risk assessment perspective: who's going to use the space? What groups of people are going to use the space? And we'll go into these in a wee bit more depth in a minute. You're not expected to know all the answers to these right now, but just have a think about that one. How often will the users in the space change? So for you guys in community setting, you could have 10 different groups or 12 different groups in a day. So the guidance under the protocol states that all frequently touched surfaces or high risk surfaces should be cleaned at a minimum twice a day. But if you have 10 different user groups within your facility, then the recommendation from an infection prevention point of view is, does that get a clean down between each user group? And best practice would say yes, it should. From a practical point of view, I would be advising you that it should be definitely cleaned down more than twice. It doesn't need to be disinfected between each group of people. It definitely should be cleaned between each group of people. And the high risk surfaces should be disinfected. They should be disinfected, but not the whole space. And we'll talk about that again shortly. What type of activity will take place in the space? So again, if we're talking about a group of people coming in to sit in one place and they're not moving around from space to space, they're coming in, they're sitting for a half an hour, and they're leaving again, that risk is fairly minimal. You can socially distance them. They're not doing any strenuous activity. Therefore, the respiratory secretions, if they're spaced 2 meters apart, will probably be negligible. The risk will be quite small. If you have people coming in playing football, 5-a-side, for example, and there's 10 people within a sports hall and they're all sweating and their heart rate's elevated and they're all breathing heavier and stuff, then that does create an additional risk. You've got to have an idea of what type of what kind of dirt, bacteria, respiratory secretions, what is going to be generated by the activity that's been done within the facility. Then is there time for a full clean down daily within the space? And again, while we can clean between users and we can clean and sanitize or disinfect different surfaces at different points during the day, at a minimum, every facility should have a good clean down at the end of every day. From the point of view, we'll go into this in a wee bit more depth shortly about disinfection. Disinfection won't work on a dirty surface. So in order for you to complete the disinfection step, you must start with a clean building. And in order to do that, that means that at least once during the day, everything should be cleaned down and disinfected. We need to identify what the high touch points are. Like, how do we actually look at a gym, for example, and see, well, what are the high touch points in a gym? We'll go through some of those shortly now as well. Who's responsible for cleaning the space? So, do you have somebody within the facility that does this for you all the time? Or are you going to have to, it's kind of everybody takes their turn in doing it. And now who's going to be responsible for doing it? Or will we assign somebody? You need to think about these kind of questions when you're looking at your risk assessment. The person that does carry out the cleaning, are they trained? And are they aware of the cleaning frequencies that are needed and why? And if it is being cleaned by in-house staff, are the correct provisions available? So if it's a case that you guys are doing the cleaning within your facility yourself, does the chemicals that you're using, do they have efficacy against the virus? Have you checked that, the cleaning agent that's been supplied is actually one that's recommended for COVID? And again, we can talk about what kind of reference numbers and stuff you need to look for. We'll look at that shortly. So reducing the risk within community group facilities itself. So one of the things, I suppose, that we look at when we're speaking to different businesses and different facilities is actually the biggest piece is raising awareness around what is new in your premises. When you reopen, who do you need to communicate? What do you need to communicate with, or what do you need to communicate to them, and how are you going to communicate with them? So consider, like, within the normal community group setting, you're going to have your own staff or community leaders, your volunteers that actually manage and run the facility. You're going to have normal everyday users of the facility. So these could be people coming into the gym. This could be parents coming in to collect children from a facility. There's all sorts of, you guys know this better than I do, there's vast ranges of different types of users that come into your facility from a day-to-day perspective. You've also got different groups that come in, and they may be renting space within your facility. Once that happens, there's an onus on them to be able to provide a certain amount of information to you as maybe the manager of the facility, to make sure that they're being responsible and they're taking everything, all the precautions that they can take as well. Especially, I suppose, there's a number of groups, I suppose, that would raise additional concerns. Like if there's, I'm aware, maybe not so much in this group, but I'm aware that there's a number of community facilities that have childcare settings within the setting. And again, there's a whole raft of different regulations around childcare settings. So making sure that you're aware of those, and that if it's a case that you're not personally responsible for the childcare facility that's there, making sure that you take stock of what they have done as well. And making sure that, I suppose, that you can identify that they're not going to pose an additional risk, that they're taking all the steps they need to take. And then obviously you've got your stakeholders as well. So most community facilities will probably have oversight from whether it be, you know, UDRAS or whatever agency is out there that's providing support for the organisation. There may be a requirement there for you to be able to answer questions for your stakeholders as well. So you need to think about all of those different groups of people that you've got to communicate with. And then you have to think, what do I need to communicate to each of those groups? So the common ones that you probably will have to share with people are your COVID response plan. Your emergency plan is one that would probably need to be communicated to everybody that uses the facility, or everybody that has a stake in the facility. It's something that I would be communicating probably 10 different ways if you can. Put it into your induction documentation, put it into your return to work training, put it into, you know, the induction for facility users, for groups, have it up on the walls everywhere in there. Make sure your emergency plan is well known. You know, new policies and procedures as well. So what is changing around the policies and procedures in your facility? So if it's a case, I'm sorry, I'm just going to mute here a wee second. There must be one or two that are unmuted. Sorry guys. So for example, if you have changed your attendance policy, for example, or your booking policy, so that groups can no longer book back to back. So if you have a class in there from 4 to 5, there can't be a class in there from 5 to 6, because you've got to allow space for the risk. It's just from normal dissipation of respiratory secretions. You've got to allow at least half an hour, if possible, for the air to be cleaner in order for people to go in there. And also you've got to look and see, are you going to actually put a cleaning process in there as well, and how do you actually manage that? So if that policy is changing, you're going to need to communicate that policy to the relevant groups or the relevant people. And then obviously what we would be advising everyone to do is any mitigation steps that you're taking, whether it be we're going to clean the hall down between every group, we're going to disinfect the toilets between the groups, we're going to do this, we're going to do that, we've new hand sanitizers at the door when you come in, please use them. All of those type of steps, document them, communicate them to the people who are going to be using your facility, preferably before they go in the door. If there's going to be a waiting area, when people get to the front door and they, for example, they have to wait to get in, is that waiting area identified for them? And what does it look like? So when they come to the building for the first time, they're going, oh, that's that picture that came out in the email. There's where I stand. And that they're not waiting or wondering what has to be done. So think about all those things when you're looking at how do we actually raise awareness for the changes that are here for our building, and then decide obviously how you're going to communicate with each group. Again, from a staff and a governance perspective, most people are training their teams online on webinars like this prior to going back in. Maybe from a group's perspective, it's a question of sending out an email with some photographs in it explaining how things are going to work, and then following up with a phone call to that group representative and just checking that everybody's on board and everybody understands. And you wouldn't shoot me a wee email back to make sure that we're all clear on this kind of thing. So you're making sure that from a governance perspective, you're keeping yourself right within your facility as well. Okay. Then we look at when we actually get to the facility. So that's the kind of the communicating with people before they come back. When we get to the facility again, whether it's an office or whether it's a community centre or whether it's you know, a charity shop or whatever it is, staff should be allocated to facilitate people coming in and out of the building. So at the beginning, when you reopen, we're talking about the first few days or the first few weeks, depending on your customer cycle, that people come in. Be aware that people, as a general rule, what I would say is for most organizations that have opened up in phase 1 or phase 2, the overwhelming feedback is that people are very patient. They understand that things are changing. They understand that they can't necessarily just walk in where they used to before, and they'll be very nearly anxious about just going on in. So make sure that if you have an entrance that people can be greeted at, or that it's very well signed for people to come in. If you have large groups coming in there, I would strongly recommend that somebody be assigned to actually manage that crowd, and that people are not coming in big groups. If you do have exterior play areas, what I would suggest, again, hand and respiratory hygiene stations should be present in those. So these are all external to the building. Consider the cleaning or disinfection of outdoor areas and play areas, especially if you've got large groups of people out there waiting in queues or whatever else. Facility entrance should have hand and respiratory hygiene station, either preferably immediately inside the door, or if you haven't space in there and it's sheltered outside, you can put it outside the door. Again, we would highly recommend entrance barrier matting as you come into the facility. The reason for this is, I suppose, a lot of people don't like mats from the perspective that they have to be maintained, number one. They can be a trip hazard if they're not managed correctly, etc. But the biggest bioburden you'll bring into a facility is on your feet. Most of us don't bring it in any other way than what's on our footwear. And barrier matting is specifically designed to extract a good 80-90% of that off your shoe before you walk onto a premises. So barrier matting can get very dirty, but the reason that it gets so dirty is because it's effective. What I would suggest is, if you are looking at something like this, there are companies out there that will do mat rental. You don't necessarily have to buy and maintain them yourself. You can power wash them, but unless you have a power washer, it makes it a bit difficult. But what you can do is you can rent mats, and people will come every 2 weeks or every week if you need it, and change the matting out, and you can be sure of having clean, fresh, effective matting at your entrance coming in and out. A lot of facilities are looking at things like indoor shoes. So for example, sports halls would kind of do this anyway. You're not allowed to wear outdoor shoes and your nice junkers flooring and stuff. That's kind of, we all know that setup. But what some facilities are looking at is having policies in place where, if people are going to be in the facility for a significant period of time, or they're going to be in there all day, that they wear indoor shoes and have a shoe changing area for people. Again, bear in mind, if you have multiple entrances into a building, so I'm thinking of a particular setting, in a childcare setting, where they would have normally had one entrance, and in order to facilitate social distancing, they're now going to use 6 entrances, which would have been their fire exits, to allow people into the building at the same time, which is fine, that works, but their indoor shoe policy has to be replicated against all of those 6 entrances and exits now, not just the one that used to be at the front door. So whatever process you put in place, make sure that it's uniform throughout the building and that everybody's aware of what needs to happen. To limit the items being brought into the facility by others. Now again, this can be a bit challenging depending on what your particular community organisation is. Now there was a particular request made around charity shops, and we will talk about that in a wee bit more depth in a minute. So I'm kind of excluding charity shops from this particular one, but for everybody else, definitely you're going to have to pay attention to what's coming into your building. If people are bringing items into your building, they're bringing in a risk. So how will those items be managed when they're in there? Something as simple as somebody bringing in their handbag. Their handbag could have been lying on their car floor. The person in the passenger seat of their car 2 days before that, or a day before that, could have had a risk infection. And that handbag's been lying on a plastic surface, and it's plastic. And now you've brought it into a building and it's sitting down on a table in a kitchen. So we've got to be aware of what comes into your facility. Is it needed in there? If it's needed in there, can it be put somewhere safely when it's in your building? So that it's not, you can't ask people to disinfect their handbag before they come into the facility, but you can ask them to put it in their locker or to put it away, out of the way, so that it's not sitting on a floor or it's not sitting on a counter. And just to be mindful, if people do need to bring stuff into your facility, where is it going to be stored and how is it going to be managed when it's in there? anywhere that facility users need to queue within your building needs to be clearly marked out for the appropriate physical distancing signage. Now again, all of these signs and meeting room signs and all that stuff are all available on the HSA or the HSE websites. And again, we can link those in the information that's gone out later on. Okay, so when you come inside the building, then consider the group size going forward when taking bookings. So you've got to try and be aware of, if you're, for example, taking a booking for a meeting in your community organisation, and you have a meeting room on your facility, you've got to take into account of how many people is it practical to actually accommodate within that space. And it's not enough that we open the windows and we open the doors. The rules are still 2 meters. Now again, that may change going forward, but at the minute they're holding fairly steady on that one. And that really does restrict down the amount of space that you can or the amount of people that you can have in a space. Assess who will manage the group when they're in your facility. So again, I'm thinking of like maybe a community hall where people come in and they play five-a-side, or they come in and they have dance class or whatever. So for that situation, who's going to be responsible for that group when they're in your facility? And have they been trained to assess and manage the risk of their group while they're in your facility? So this would all be identified within the risk assessment. Abide by, obviously, when it comes to any kind of child activity, you have to abide by the existing adult-child ratios and regulations. So if it's a case that, for example, you have a group of kids in there and there needs to be a certain amount of adults along with them, then you need to accommodate or reduce the group size to make sure that those adults are all present. Risk will change when people change within the space. So again, this is something that somebody asked on a training earlier today, actually, was around ECCE classes, for just using that as an example, where they have a group of children in the morning, and then they have a group of children in the evening, and then other people use the space at night time. So it is a community setting as well. And I suppose best practice there would say the building should be deep cleaned, disinfected once per day, and then that would leave it clean for the group coming in the morning. When that group in the morning leaves, it should be cleaned again. Doesn't need to be disinfected, but it should be cleaned again, and then it should be cleaned again prior to the third group starting, and then it would be cleaned, disinfected at the end of the day. That would be best practice. If that's not practical, then I would ask the question, what is reasonably practicable for from the grounds of a health and safety authority person coming and asking you, why did you not disinfect that space, or why did you not clean that space during the day? That's the question. That's the people you'll have to answer this to. If, for example, somebody in one of those sessions, those 3 examples that I've given, the 2 childcare settings and a group of 5-a-side, say, and you've 10 in each group. So there's, in the space of the day, there's 30 people that have been using that space. Public health rings and says, we've had a confirmed case and they've been in your facility. Then what will happen there is they'll ask for the names, the log of who used the facility on that particular day or for the 2 weeks previous to that. And then they'll ask, okay, and what mitigation steps have you in place? Have you cleaned between these groups? No. So there's 30 people now that we have to contact instead of 10. Yeah, that's the question you have to answer. So it may seem like an excess, but there's a reason, I suppose, that these cleaning steps and these infection prevention steps happen. And it might be a bit of a change for people to have to allow an hour between sessions or whatever, instead of being able to jump straight into the next session. But the reason we're doing it, I hope is clear, is that we can reduce the amount of people that need to be contacted in the event that a case gets into the facility. What we're trying to do is to make contact tracing as easy as possible and for the least amount of people to be affected as possible as a result of the activities that we carry out in the facilities that we have. So records of groups, adults and children should be maintained for public health records. So again, from a public health perspective, what will happen in the event of a case being notified to them in conjunction with your facility? They'll contact you. They'll say, we need the records of who used that facility within a set space of time. and they will provide guidance from there. But the things that they'll look at is social distancing, they'll look at cleaning measures, they'll look at all of that sort of stuff to see, and they'll look at, in extreme cases, they'll look at things like training and that as well, but obviously that's in a very severe situation. But they will look at things like, was the premises clean and disinfected at particular times? And if it was, it reduces the risk. And obviously then the amount of people that need to be contacted thereafter. Just on maintenance of records, from a GDPR perspective, again, most of you will probably have a GDPR officer, or you'll have access to one. I would check with them what's the required, I suppose, what's the requirements around this. We would recommend that they be kept for a minimum of 2, probably 3 weeks would be safer. From a public health perspective, that's how far they'll go back, but there isn't really any reason to keep them thereafter. So if it is a case that you're keeping records of who attended and all the rest, consult your GDPR representative or your GDPR person within your organization, and make sure that there's a process around that you can document. We're holding them for 21 days and then they're being shredded, or they're being disposed of in whatever way. Just to be aware that there is still data protection issues there as well. So we're also required, as mentioned before, to provide signage throughout to ensure awareness of social distancing. So again, think about entranceways, in and out of toilets, and again, things like toilets, changing rooms, all that sort of stuff. You'll need to look and see what's the maximum capacity within that building. And I've seen banks of toilets, 10 toilets long, that traditionally would house 10 people using them and 10 people at the sink, and now the entire room has been reduced to 2 people. So there's only 2 toilets open and 2 sinks open at any given time, and that's in a bank of 10. So the smaller the space, toilets in Ireland traditionally don't, especially in buildings like what we're talking about here, traditionally don't have a lot of windows. We tend to be in a room. We've all right ventilation, we've a few vents in there, but there's no windows really. And that's a challenge from a space perspective and an air circulation perspective. It's harder to ventilate a room that doesn't have that facility. So we have to look at that and see how many toilets is it safe to leave open in your facility, and having them all opened is not an option, especially if you've got 2, 4 or whatever in a very small room. Provide hand and respiratory hygiene stations throughout. So again, look at the risk levels and look at the risk areas, canteens, toilets, entranceways, exits, in and out of the gym, in and out of a meeting room. All of those type of spaces, you've got to look and see, from a risk perspective, has the risk level changed from here to the room that I'm going into, and should there be a hand hygiene station or a respiratory hygiene station there? And then obviously looking at things like breaks. So if you have 4 or 5 people there and you have a very small canteen, obviously you're not going to be allowed or able to facilitate everyone having lunch at the same time. So we need to stagger our breaks and stuff as well. Oh, sorry. What did I do there? Me and technology. Sorry, guys. Can you all still, yeah, hopefully you can still see that okay. I'm not sure what I did there. All right, so physical distancing. I suppose any of you that do have young children in the facility, I suppose it's important to understand and accept that physical distance isn't going to be practical for a lot of what you do. And I'll reference the HPSC guidance again for childcare settings, and that's a very specific document, and I'll attach it to what I'm sending out for Margaret. But just I suppose to be accepting of the fact that young children, we can't physically distance for the very nature of the type of work that happens there. We need to make sure that we're arranging sessions with time gaps to avoid overcrowding. Again, I've referenced this already. The distance of 2 meters is recommended in all circumstances. Again, there's exceptions there around childcare provision, but in all other circumstances where it's older children or adults, 2 meters is the requirement. Again, that may change, but they're being very firm on it at the minute. Anywhere where facility users need to queue wait needs to be clearly marked. We've covered that one already. And then entrance and exits, again, assessing the risk there. So from the perspective that when people are entering a building, exiting a building, even if they're staggered, you're going to have a situation where people tend to congregate. And I haven't seen Johnny now for 12 weeks and they're standing outside having a wee yarn. We need to be proactive, empathic, kind, and all the rest, but we have to assess the risk for our building. And if it's a case that that's creating a risk, then maybe we need to reassess the physical distancing measures and how do we actually manage that going forward. And it's a difficult, sometimes it results in difficult conversations needing to be had, kind conversations, but would you mind moving it along there, please? Because at the end of the day, it is putting themselves at risk, but it's also when they come to your facility, it's putting your facility at risk as well. So specific challenges to consider, I suppose, around your specific settings. Charity stores are one that came up that I think there's a number of you here that have charity shops or charity stores, either standalone or within your facility. And the three things that stand out for me from a risk perspective there is people are bringing in donations. Again, they're bringing in things from a higher risk environment, and that creates a challenge. And then the display. So how do you handle people handling things within your store or within your setting? And then obviously the changing rooms area as well, something to consider. So on each of those, donations, for the primary donations that most charity shops get are probably clothes or toys and household goods. Again, maybe if somebody wants to jump into the comments there and correct me if I'm wrong, but essentially around clothing, the recommendation would be around clothing is that all items that come into your facility should be handled. There should be PPE worn when you're handling it and you're taking it to a storage area. So it should never be unpacked within the shop. It needs to be left somewhere like a store or out in a warehouse area or whatever store area you can find. And it needs to be left there for 72 hours at a minimum. At that point, when the 72 hours has expired, again, PPE will be required here, because once you start to move clothing and shake it out and all the rest, you're creating aerosolized pathogens basically, and that in itself is quite dangerous. So the recommendations that I would give you is that you should be at a minimum wearing gloves and you should wear a mask. If anybody's in this situation, I can give you more specific advice around what PPE to wear. But when you're unpacking clothes from those bags, a mask and gloves would be a minimum requirement there for your own protection. Clothes should be hung, and again, they can, from a disinfection perspective, they should be steamed before they're put out on display. And again, making sure that if you don't have that step in place, you're going to need to consider what other alternatives are there for disinfection of clothing items. Steam is definitely one that is very effective. From the other displays within the shop floor, again, this is something that comes up with a number of different retailers, where how do we stop people touching stuff? And the bottom line is you really can't stop people touching stuff. You can advise people not to touch stuff, but inevitably it's human nature. I think in a smaller store environment, you've a wee bit more control over the number of people that you're going to be able to allow into the facility. You can visually watch what they're touching and how they're touching it, and then you can take corrective action once they actually leave the premises. Again, you can actually go over and give that a wipe down. You don't need to disinfect everything that people touch. A simple clean down is sufficient, as long as everything's been cleaned and disinfected at the end of the day. Changing rooms are an exception. Changing rooms are something that do need to be cleaned and preferably disinfected between users, simply because of, again, the very nature of what we're doing in there. We're taking off clothes, and no different to aerosolized procedures or changing beds, for example, in a hotel or in a guest house. That, for want of a better word, that like wafting of clothes can create aerosolized pathogens that we can then inhale and breathe in, and it can create quite a number of them. So changing rooms are something that, if you have, for example, 3 changing rooms in your store, 1 would be the maximum that you should have in use at this particular time. And once that one is used, close it off and use another one, and let that one settle for an hour before you clean it, and then change to the third one, etc. So again, if it's something that maybe John or Margaret, you'll have a wee look at the comments and see, was there anything specific on that one I can answer before we move on. But definitely, I mean, charity stores are challenging from the perspective of, it's the type of information that, or the type of service you're providing, the type of products that are coming into your facility, that would be a concern.
Can I come in on that, Annette? There was
Sure.
a question that came in, and it's
Yep.
just, I suppose, clarity around some items as well. Just around the donated items. So if they arrive in a black bag,
Yep.
they're left set for 72 hours. You go in wearing your PPE, you open that bag up. Is that, just maybe it wasn't clear to me or to this other person, is it okay then for those items to be put onto a rack and displayed, or do they have to go through another process?
No, they would need to be steamed.
Okay.
Yeah. Well,
Okay.
the recommendation would be that they would be steamed, yeah.
Okay.
Yeah.
And with regard to the masks, somebody was asking about the quality of masks.
Yes.
Are the homemade ones, that were made suitable, or is it?
No. Masks for aerosolized risk, you need to have a mask that's known as an FFP2 or an FFP3 or above. So even a medical grade mask wouldn't be sufficient in that circumstance. It needs to be a proper N95 or above. N95, I think people are more familiar with. But you can get them in your local hardware store. I know there's a lot of press around how difficult they are to get. Like local suppliers here, for example, in Letterkenny would be like Watson Hire would have them. The Creamery have them. There's lots of local hardware stores that'll have these specific masks. But definitely, if you're taking in donations and that's the challenge, I would certainly be recommending a mask for taking, once they come out and you're having to shake them to get them to be hung up and steamed, then yeah, you will have an elevated risk there. Even after the 72 hours, I wouldn't be 100% certain when they're packed so tightly like that, as they tend to be when they come in black bags. I wouldn't be 100% certain that it would be completely inactive at that stage. I would be overcautious than take any chances.
Okay, that's fantastic. And can I add just as well,
Yes.
there was a question, or you went through all the list of surfaces earlier,
Yes.
metal and glass. What about wooden tables or kitchen tables and things like that?
24 hours is the kind of the guidance at the minute around wood. There's some wood, like, again, I kind of don't want to confuse people, but untreated normal wood is 24 hours. For wood that have polyurethane coverings on them or polish, again, it's a plastic surface and should be treated as such.
So things kitchen like worktops and stuff.
Yeah, your Junkers floors, for example, in your gym area, or your sports floors, tend to have a plastic element within the polishes and the coverings. They're the sealant that goes on those floors, and they should be treated as such. So not straightforward wood, I'm afraid. Again, unless you have people kind of on the floor, it's not, once a day should be sufficient in normal circumstances. But if you've people like doing Brazilian Jiu-Jitsu and they're in there on their bare feet, or there's children in there, then that's definitely a higher risk you need to consider, yeah.
And carpet, I suppose it depends on the carpet, does it? Is it natural or?
What kind of setting?
The question came in, I think it's a community set, or actually it's knowing the person who asked the question around carpets, it's a service like a drop-in center with counselling rooms and stuff like that.
Okay, vacuuming is sufficient in that circumstance. Again, it would be, you've got to consider the risk to user. So if it's adults that are coming in, they're highly unlikely to be, going around on the floor. It's their feet that would be on the floor. And if you've barrier mat in there, you're going to be eliminating that risk on the way in and the way out. But from a carpet perspective, it's fine to have carpet in a facility, and vacuum it on a daily basis is sufficient. If there's an increased risk at the site, so if you've had a known case in the premises or a suspected case in the premises, then obviously you'd have to look at how do you disinfect carpet in the event that something was to happen in your building. But from a day-to-day perspective, you wouldn't need to worry about it in that sense, only if there was a known risk. And again, steaming your carpet would be sufficient there, or you can spray a disinfectant or a virucidal onto the carpet. Just can't be a chlorine-based disinfectant, obviously. But there's lots of other disinfectants out there that you could use in a mist form or a spray form to disinfect the carpet if the risk was elevated. But in normal day-to-day circumstances, in that type of environment, it's fine. In a childcare setting, I would recommend, if there's carpet in a specific room, I suppose it's not something that would be recommended anyway, but if you had a setting that had carpet in a room and there was young children there, that's something that we would consider to be a high risk. If you've mats and stuff that you can remove, great. And, mats that are washable are ideal. But if it's carpet in a room with young children, that can be a challenge, yeah.
Okay, and that actually leads us to another question around advice with regard to cleaning agents and the cleaning regime. So you said there was certain code. Oh, you're getting to that, sorry.
Yeah, you're all right.
Okay.
We have another half an hour, am I right?
Yeah, we'll keep going if people are happy to stay with us. So there is a few other questions. Yeah, we'll come to those. So thank you.
Awesome, no problem. Okay, so group activities. So again, the type and the nature of the buildings that you're in, you're going to have lots of different types of groups interacting within the facility, and the things that you need to watch out for, I suppose, when you're doing your risk assessment or you're doing your COVID response plan, look at the timings that those groups are in and out and space between to actually mitigate risk. Look at your contact tracing. So have you a record of people coming in and out of your facility? Make sure that the responsible people are in place. So do you as a group or as a building, as an organization, have a responsible person or persons? And then for the groups that are coming in, who is the responsible person for those groups? And have all of these people been trained? And that's kind of something that they've isolated and they've knocked out a few times within the protocol, is that we are responsible for training. The other challenges that are specific to a lot of the community facilities are around shower and changing areas. And I mentioned this earlier in respect of social distancing and bathrooms and stuff. What was normal before, to have, lads coming in from playing soccer or playing football out in the pitch, and there might have been 15 or 20 lads using the changing room, that cannot happen anymore. And how do you still provide the service but provide a safe environment for changing and showering facilities to work there as well? And that's something that, again, discussion and talking with your groups will identify and say, listen, we have no issue with you coming here once sports and team sports of that size are allowed, but bear in mind we can only operate one shower at a time, or we can only operate 2 showers at a time, whatever your facility accommodates. So having those conversations before we take bookings, I suppose, it's just something to bear in mind going forward, that what normal was before, unfortunately, it'll be a while, I think, before we see that again. The other challenge, I suppose, is equipment, and equipment shared by employees. And what we're talking about here is, for example, in a community centre, you could have 2 people on during the day that both are responsible for cleaning. You don't necessarily need to have 2 sets of cleaning kit for those people, but the kit should be disinfected between users. And again, it's no different to a child care setting in the morning and a preschool setting in the evening, that there should be a cleaning that happens between those 2 groups. The same applies for people that are sharing equipment. So if you're in an office environment and you work the morning shift on reception and you're using your computer, and I've talked about this before, our respiratory secretions, our breath is going on to our computer and contaminating our computer, and somebody comes in the afternoon and they sit at that desk for 3 or 4 hours, then that's a very high risk situation from an infection prevention point of view, it can be taken care of quite easily. You can have a disinfectant wipe or a laptop wipe or whatever you call it wipe, and make sure that that's cleaned after you leave your station for the day, and make sure the desk is cleaned and stuff. But to be aware of that when you look at the space, who uses what equipment and how many people share that equipment during the space of the day. And again, obviously, in gyms and stuff like that, look at who shares equipment. And again, particularly in gym settings, the risk is considerably higher, simply because of the very activity that they're doing. And the stuff we would highly recommend is disinfected or at a minimum sanitized between users. And we'll explain what those disinfection and sanitizing means now in a wee second. So hygiene and cleanliness for COVID-19. Hand hygiene facilities and bins with instructions for users should be available within the premises. Respiratory hygiene facilities, and what they mean here is tissues. It's nothing fancy. Tissues and bins that are emptied regularly with not inspections, that should say instructions. Sorry, my typo, for adults and children. Hand hygiene placement should be considered. So again, if you have playground or maybe childcare rooms within the facility, you need to make sure that these are placed in a way that's accessible but safe. And then obviously the entrance area, canteens, toilets, any rooms, meeting rooms, etc. And then the gym, if you do have that. Maintenance of same. So who's responsible for the replenishment and stock orders? And again, if it's a voluntary organisation, maybe it's a case that there isn't anybody responsible for that now at the minute. When it runs out, somebody goes and gets some more and we all pull our weight and do our share, but it running out can't be an option anymore. So somebody has to be responsible for making sure that that's checked regularly. If you do have hand washing stations, and I suppose to reiterate, hand washing is way more preferable than hand sanitizing. They get rid of the virus in two very different ways. And both they're fine. Hand sanitizing is fine if hand washing is not available, but we would highly recommend, where possible, hand washing would be preferable. Soap and single-use hand towels are best practice. Hand dryers should be taken out of use completely. And if you do have hand dryers in your facility and you don't have hand towels, I would consider maybe that's something that you might need to, that would be identified in a risk assessment. You would need to identify another means of people drying their hands other than hand dryers. It's not recommended in the current, just the way the virus spreads. It's quite dangerous. Obviously, like normal household towels would not be acceptable either. There's too many uses between them being washed. Sorry, my typo on this page is terrible. Childcare areas, so minimum, if you do have childcare area within your setting, the minimum is this hand sanitizer, and hand wash areas are mandatory, and they must be like a short walk from the childcare setting. They shouldn't really have to exit the room if possible to get a hand washing station, simply because of the nature of the childcare setting and the fact that there is no social distance in there. Soap should be pH neutral and preferably unperfumed if you can. It doesn't need to be antibac, it doesn't need to be antiviral, it doesn't need to be COVID soap, none of that. Ordinary soap is fine. Liquid soap preferably. And then sanitizer. So again, like the recommendation is, it's actually 60%. I don't know what's wrong with me today in these slides, sorry folks. 60% for the alcohol content for adults, and there are more child-friendly sanitizers out there for children. Somebody mentioned to me on a previous webinar about the product Dew. Now again, I've requested confirmation that it is actually effective against this particular virus. I'm waiting on word for that. They haven't responded yet, so I will clarify that once they come back to us. But whatever you're using, whether it's cleaning chemical or sanitizers or anything else, you need to be sure that it has efficacy against this particular virus. Then we look at how clean is clean enough, and I suppose there's kind of four main levels of cleanliness that would be common within the built environment. And what we were used to before was clean. In most circumstances we were used to clean, and that was fine. We were all happy enough with that. Sanitized is what you would generally find in a working kitchen. So they would have to be a level above everywhere else. Disinfected is the next level of cleanliness up, and that's what we're aiming for with the prevention of spread of infection of COVID. And then the sterilised environment, obviously that's for clinical settings, pharmaceutical, clean room, all that type of thing. And we don't need the world to be sterile. We'd be in bother if it was. So we don't need to go to that level, but we do need to provide a disinfected environment to get rid of this virus. So how do we make sure that our spaces are safe? Cleaning on its own with regular cleaning agents are fine, but it isn't effective at making a contaminated surface safe from COVID-19. You need to use the two-step process, and that's environmental cleaning plus disinfection. And the reason we need to do that is because organic matter inactivates a lot of disinfectants. So if you apply a disinfectant agent to a surface and that surface is dirty, then the effectiveness of that disinfection agent is drastically reduced. It may not work. The other thing that we would find quite commonly is people will spray a disinfectant agent onto a surface and they'll wipe it straight back off again. And that's one that it's absolutely pointless. You're better off saving your disinfectant because it just doesn't work. Cleaning agents and disinfectant agents, they require a dwell time. They need to stay on the surface for that required dwell time, depending on the virus and depending on what it is that they're trying to achieve. It has to stay there and it'll be allowed to do its job. If you spray it on and wipe it straight back off, it's effectively done nothing. Might have created a nice smell, but we're creating a false sense of security that surface is still not clean. So when we say during the day, in most settings, cleaning is sufficient, at the end of the day, the deep clean plus disinfection step needs to happen in order to reduce the bioburden down, to make sure that that surface is safe again for the next group of people or the next day's activity. And we're just going to briefly go through a wee bit about disinfection methods. So there's 4 main ways that we disinfect or sterilize an environment or a surface: heat sterilization, liquid disinfection, vapor or gas, and radiation. Now the 2 that are kind of relevant for normal everyday situations are heat sterilization and liquid disinfection. Heat, we use steam, we've mentioned before, for clothing and stuff like that. Again, maybe if you've got, you know, I see people going on with vapor and gas disinfections to like cars and taxis and stuff, and it baffles me why we would use something so strong and so robust in a circumstance or in a situation where, you know, a handheld steamer will do as equally good a job and it'll be safer and quicker to get the vehicle back on the road again. But that's me and my cleaning hat on again. Other means of heat sterilization, you've got your dishwashers, glass washers, all of that type of environment, so, or that type of equipment. So if you have, for example, I'm thinking in a childcare facility, you've got lots of toys and Lego and all that sort of stuff, whack it in the dishwasher. It's the fastest way to sterilize it. You don't need to put chemicals on it. You can simply put it into the dishwasher, 60 degrees or above, and away you go. Same with, we'll talk about this in the emergency procedure. If you have a situation where you have clothes that need to be disinfected, or maybe uniforms and stuff like that that have come out of somewhere, your own team's equipment, washing above 60 degrees and then tumble drying again on a higher heat, if the clothing can withstand that, again, that will provide a sterilization, heat sterilization as well. Liquid disinfection is probably the most commonly used disinfectants or disinfection method that we have. And essentially we're diluting it into water at very low ratios, and we apply it onto clean surfaces and let it air dry. You can either wipe it on or spray it on in a mist form or whatever, and that's absolutely sufficient. There's no need to be going for the other levels of disinfection that are out there. They're fine in their own circumstances, and there are circumstances where they're absolutely the most efficient way of doing things. But to use a vapor or gas disinfection, for example, in a small office or something like that, it's too much. The risk that type of chemical application causes is greater than what it's trying to actually solve. So you've got to look at what's relevant and what's, you know, I've quite often had people ask me, do I need to buy one of them big foggers and have it in the building? And no, you don't. You know, we'll go into what disinfection agents are suitable now at the minute. And then obviously you've a radiation disinfection as well. So this is things like UVC light. And again, brilliant product, very, very great efficacy against the virus, not relevant for most commercial settings. It's more relevant for clinical settings, etc. There are lots of new products coming onto the market at the minute, and there's not lots of new gadgets that I see about people waving lights over their stuff. UVC radiation is a powerful light emission, and if it's effective enough to kill COVID, it's effective enough to burn you. So if it's not strong enough to burn you while you're radiating your phone, then I would suggest it's probably not got efficacy against the virus either. So just be careful of all of the new things that are out there at the minute. Good old dishwasher, steamer, and then we'll go into the disinfectants now in a minute and which ones are effective. So 4 things to consider when you're choosing a disinfectant agent. Its effectiveness against the virus is primary number 1. The organism you're actually dealing with here is an envelope virus, so it's quite easy to inactivate and kill. What I would suggest is that if you're buying a disinfectant agent or you're being approached by chemical companies, what you're looking for is, and you can write this one down, is a number. It's a chemical reference number from the ECDC. It's EN14476. And if the chemical is effective against coronaviruses, envelope coronaviruses, it will have that reference number on the bottle, or it should have that reference number on the bottle. If it doesn't, I would ask your chemical supplier to furnish the evidence that it has that number, or that it's approved against that specific EN number. And that'll tell you whether or not it's effective against a specific disease. The kill time, so what's the required dwell time and will it be achievable? So for example, if you use Milton, for example, and you use it in concentrations of 1:100, the kill time on that, or the dwell time on that, is between 3 and 5 minutes. So is that efficient? Are you able to allow that it sits on a surface for that length of time before somebody else will use the facility? So it's probably fine for most end of day cleans, but if you're looking about disinfecting high touch surfaces during the day, like toilets and taps and sinks and stuff like that, maybe 3 minutes is too long. You're not going to be able to leave it that long. And maybe you need to look at something stronger than that. Safety. So again, I've mentioned this before, is hydrogen peroxide really needed in a home or in a small office, etc.? I would suggest not. Circumstances and environments where that's very safe, and then there's environments where it's not. The ease of use. So what's the most efficient means of getting the job done? So I suppose to speak about disinfectants, sanitizers and cleaning agents for just 2 wee seconds, I'm not going to keep you long on this. That, if you can see that surface on the end of the pen, that will hold approximately 1 million bacteria. And in each of the chemical agents that we use will have a log rating, and it's essentially how quickly it can kill bacteria or how quickly it can reduce the bacteria down. And like something along the lines of Fairy Liquid would have a log of 1, where it effectively kills 90% of the bacteria in its cleaning process. But what we're looking to get to is that disinfected stage, or that disinfected level of cleanliness. So a log kill 1, 2, or 3 is not sufficient. And I've quite often over the last number of weeks, I've gone on to sites and seen we're using a sanitizer as the disinfectant agent. That sanitizer will only reduce the 1 million bacteria on the head of that pen to 1,000. Even in its cleanest, best practiced, the best result that you'll possibly get from a sanitizer is 1,000 bacteria still on there. So if you multiply that out across a keyboard, how many million bacteria are still on that keyboard, and how many of them are you still touching? So I would suggest that when you're looking at your chemicals, it must be a disinfectant agent that you use. Common types of disinfectant agents. Now, again, you're going to need to look at the surfaces that you are putting this down on. And again, when you're looking at the actual ratios of disinfectant agents that we're recommending here, they're very, very mild. This is not, you shouldn't get a smell from this ratio or this dilution of chlorine. When you put 10 mils into a litre of water, you shouldn't get a smell of bleach off that. It should pretty much smell like water. Same with the chlorine tablets. You shouldn't get a smell. If you get a smell, there's too much bleach in there. There's too much chlorine in there. So we disinfect high-risk areas as they're required. We disinfect frequently touched surfaces daily following the environmental cleaning. So again, we don't need to disinfect every surface. We only need to disinfect the surfaces where fomite transmission is a risk. And that are things like our door handles, stair railings, lift buttons, toilets in general, toilet taps and flush buttons and door handles and toilets, that type of thing. But again, if you have higher risk areas, then we need to consider those during the day as well, if you have very high risk environments. So if we're using chlorine-based disinfectants, there are two main types. You have a liquid disinfectant and a tablet disinfectant, or a chlor-tab. Concentrations should be 1:100. So for example, if you're using liquid Milton or Domestos, 10 mils, which is tiny, it's 2 teaspoons into a litre of water. So the dilution rate is really, really small. And then chlorine tablets, obviously they're pre-measured, so it's only 1 tablet per litre of water. Now again, if bleach is something that you absolutely cannot have in your building for whatever reason, that's fine. You can go ahead and order a virucidal, or I can give you a recommendation for lots of other types of disinfectants. What I would suggest though is to make sure that they are effective against this particular virus. And as I've stated, the number you're looking for is EN14476. So regularity of cleaning and disinfecting will depend on your risk assessment. So the more people touch a surface, the more it needs to be cleaned, or more often it needs to be cleaned. Cleaning of frequently such touch surfaces should happen regularly throughout the day and in line with higher risk. So, if people are eating in the premises, the tables that they're eating off or the surfaces that they're eating off need to be cleaned before they eat. And likewise, if you have childcare setting, changing areas, stuff like that, need to be disinfected after each use. And again, we've mentioned this previously about the groups that are there in the event that you've got two different, I'll use that childcare example again. If you've got two different childcare groups within the same setting in this, in a 24-hour day while the facility is opened, then that needs to be cleaned between. So once daily for all areas between users, and then high risk situations need to be disinfected then obviously as it happens. So toys that children can put in their mouth, for example, or if equipment's contaminated with bodily fluids or blood, etc. And again, we've all seen stuff like this happening in sports environments where somebody falls and or they're sweating on top of stuff, that type of thing. We need to be careful around those situations. They are higher risk. So in the event that you have a suspected case of COVID within your facility, so we've recommended here a COVID-19 emergency response plan. And what I would, I suppose, reinforce here is that you don't wait till you get a confirmed case. If you have a suspected case, this plan really would need to be put into action to mitigate your risk. If you wait from receiving notification of a suspected case to waiting, so we'll wait till we get confirmation that they have it before we act, you could have 36, 48 hours have elapsed, and how many people could have used your facility within that time. So if there's a suspected case, this is what needs to happen. Identify an isolation area to be used in the event of a suspected case. Other areas that the suspected case may have used should be treated as the plan goes below. So you need to be able to identify, if somebody comes to you and says, listen, I've been notified I'm a close contact of somebody that's tested positive for COVID, you need to be able to identify where that person was in your building within that time, that relevant time period. So all staff should be trained on this procedure and in their role in implementing it. If the area has been used, your isolation area that is, should be thoroughly cleaned and disinfected prior to being used by anyone else again. So your isolation area doesn't have to stay an isolation area forever. Your isolation area, it's totally okay to have it used as something else during the day. And then when it becomes an isolation area because of the notification of a suspected case, no one uses that space again until that person has vacated the isolation room and it's cleaned and disinfected. Any laundry that comes from that area should be washed on its own above 60 degrees or higher if the material can withstand it. Waste from that room should be double bagged and left for 72 hours before disposal. And then staff that are working in that area, either with the suspected case or cleaning after the suspected case, should have the appropriate PPE, and that PPE should be available immediately outside that room. So they should have a mask, gloves, and a plastic apron. So the cleaning procedure that needs to happen in isolation area or any other area that's contaminated by a suspected case, we wait 1 hour minimum following the affected person's departure from the room. And I've mentioned this earlier, the reason we do that is to allow the respiratory secretions to fall to the floor. Even if the suspected case has been given a mask when they go into the room and they've been asked to keep the mask on while they're there, even aside from that, allow an hour to elapse before anyone goes in to clean that space. No matter how much pressure you're under to get the room opened again, do not take the risk. I would advise that at a minimum you wait an hour. If you can afford to wait a wee bit longer, that's fine. Prepare your cleaning solutions and disinfection kit outside the area and take it to that area. So preferably your isolation room shouldn't be your cleaning room as well. You want to make sure that you can prepare all your cleaning kit and your PPE and all that outside the isolation area and then go in to us. You're protected before you go in. So I've mentioned that don your PPE outside the area. Remember to not touch your face when you're going in there. Enter the room, ventilate the area, and then open any windows and doors. Clean the room, furniture, fixtures and fittings, paying attention to your frequently touched surfaces. And then when that area is dry, carry out the disinfection step. And then when the disinfection step is dry, then you can open the room for use again. That's fine. So the last thing I want to cover, or there's another sheet after this one, but I don't know if we'll have time. I want to allow time for questions. To ensure the facility systems are working when you go to reopen. So things that'll have been, most facilities will have been closed now for 10 or 12 weeks, or depending on when you're opening. If you're not opening to September, it may have been closed for quite a considerable time before this. You've got to look at things like your fire detection systems, your alarm, your heat, make sure all your windows and doors, etc., are all intact. And then if you've got tanks or anything like that in your facility, you need to be aware of Legionella. And I'll link the Legionella advice sheet to this document, or to the documents I'm sending Margaret as well to send out. The facility should be deep cleaned. Again, no reason that can't be your own team that do that, but just make sure that the dust levels within the building are well reduced before you open up again to users. Risk assess and draft cleaning regime, including identifying all the frequently touched surfaces. Set up controls, entry log and sanitizer at all entry points to the facility. Again, your entry log may not be like on the door, it may be at reception or whatever, but just make sure that there's a process around recording who comes into the building, etc. Set up your 2 meter social distancing throughout the workspace. Install physical barriers if they're needed where social distancing isn't possible. Install sufficient signage and safety notices. And again, these are all available on the HSE websites. Provide any necessary material and equipment for your cleaning regime. Provide all hand and respiratory hygiene solutions where required, and provide the adequate PPE if required. And again, with regard to all of this, there's a training element that comes with it as well. So on the last slide there's basically an information that your induction training or your training of users should include. And that's obviously, you don't need, I'm not going to go through all that now. But it's essentially what you should be advising and training your own team or your own users on for going into your specific facility. So I'll just open this up again. John, can I unmute you? How do
Yeah,
I
that's
unmute?
me
Oh,
unmuted
you.
there now.
Perfect.
There's quite a
Okay.
lot of questions. Sorry, John, do you want to, there's quite a
You're
lot
all right.
of questions, and I don't know if we're going to get through them all from a time perspective, but maybe I'll just sort of start
You
do a
Yeah.
few.
work away.
John,
Yep.
is that
Yep.
right? Somebody has a cleaning agent EN1276 and EN13704. Are they not considered sufficient?
1276 is fine. The other one is not. No.
Okay.
Yeah.
Would using a steamer, where appropriate, allow you to reduce the amount of chemicals?
Yes, it would. There are lots of disinfectant agents out there that are and they're eco-friendly. They're not as severe. And if anybody is interested in that type of stuff, we can absolutely. Obviously, there's an expense there. They're normally more expensive, the green products. But if somebody's specifically looking for that, I can give you advice on that for sure.
Perfect, thank you. Would you have a list of names of companies that provide the barrier matting?
Yes, local. There isn't any there's no Donegal based companies, but there are companies, Irish companies that do. There's 3 that I can think of. Service Matters would be based in, I want to say Mullingar or Roscommon. They're down that direction. Celtic Linens are another one. Canon Hygiene. There's quite a number, and they'll do mat rental. You know, say they charge a couple of euro per mat per week, and they come and change them every week. So it's not a massive expense. Yeah.
Okay. What did we see? What about water quality in the building with regards to Legionnaire's disease?
Yeah. I'll link the Legionnaire's guidance to the documents I'm sending you on, Margaret, if that's okay.
Yeah.
There is specific guidance there. All right. If a building has had, obviously, if you've water storage within your facility and you've had a building lying vacant for a while, Legionella is a big risk. Same with even showers and stuff that haven't been used for a while. And in any circumstance, there should be management of Legionella happening anyway. If you have showers in the building, you should be doing that every month. But if you're not familiar with how to do it, we'll link the guidance with the document you've got. Yeah.
And from somebody that manages a centre, Annette, if an organisation, a separate organisation books to use a room within their centre, whose responsibility is it to provide training to participants? Is it the centre's responsibility, or is it the outside organisation that's renting the room?
The outside organisation, are they renting it on a long-term basis or a like?
I'd say it's a session.
Coming
in for a couple hours. Yeah.
What I would suggest is whoever that responsible person is from the renter, the rentee. What is that? The rentee, not the landlord, not the manager. The people renting. That the person responsible for that group should be signing that they are aware of what the procedures are around social distancing, etc., and that they take full responsibility for the group that goes in. Yeah.
Okay.
There's a question here as well. If the space is 20 foot by 30 foot, how many people can fit on there? But that's really, 2 meters apart is, really
not many. It depends on what the activity is going to be as well. If it's an office environment where they're going to be sitting, possibly you might get 4 in there at a push, but
Okay. And one last one quickly from me.
I have a few after that. Don't go anywhere.
Not going anywhere. We'll play through as quick as we can. This person has a group that comes into the building. This is arts and drama, bringing in props. They stay for 8 hours and they leave. How best can you work with those, that type of group?
Oh, props.
Props are taken in and removed.
Okay. Have we any idea of the material of the props or where they will have been before? Somebody's nodding their head there. You see the risk that I'm seeing? Do you want me to unmute you? Is it your question? Yeah, go ahead. Hold on. Oh. Why is it not letting me unmute you?
If you come out of shared screen, I think we might be able to see everybody then.
Oh, sorry. Are you still on that?
Perfect. Yeah, that's better. Yeah. So it was Ailish that asked the question. So
I did. Annette, it was very interesting. It was just when you were talking about all the stuff, like I could have a truckload of furniture coming in. When I said props, I meant sets and boards, and you know, I mean, a truckload could come in. Now they come in, they set up on the stage, all of that, and then they bring all their stuff with them. But,
right.
yeah.
How long would that sit before any of your people are using or in that space?
It would sit for, they shouldn't be anywhere near it while they're building it, and it would sit for about an hour or two before my people would be near it.
Okay. I was kind of hoping you would say like 48 hours or something.
Oh God, no, it's all done within a 12-hour period. They're in, they set up, they do the show, they're gone.
Right, okay. And have you had any indication from them as what procedures they are taking?
Well, not yet. This is what if I know what to say to them, have they cleaned down the furniture? Maybe I could direct them to tell them what to do, disinfect stuff. You know?
Again, this is where maybe your non-toxic and your environmentally friendly ozonated water and stuff would come in, where it's absolutely completely toxin free. And if necessary, as it's coming off the truck, you could potentially have it disinfected at that stage before it comes in, if they haven't done it already. It's just the risk is when people are bringing stuff into your building. Now, I was thinking of things like lunch boxes and stuff.
Yeah, and handbags.
Furniture.
Yeah.
But yeah, there's solutions there that can help. But I would definitely be asking the question from them, what precautions are they taking to ensure that what they're delivering you is safe? Yeah.
That's great, Annette. Thank you very much.
Stuff, Ailish, just let me know and I'll
please. I would appreciate that. That would be great.
Very good. So, Margaret, can I take over for a few questions now? Yeah, there is a question in around the use of mechanical ventilation in a bathroom. I take it that's the extractor fan. Is that to be left on?
Yes.
Yeah.
Okay. Needs to be circulation. Yeah. Hand dryers, no. Air ventilation, yes.
Okay. And question in from a day centre. How do they deal with mail coming in? I suppose they have a very vulnerable cohort of people, and this centre would also have residents that live there permanently.
If possible, if mail and deliveries can be left isolated for 72 hours before it's opened.
Okay. Groceries is their other part of their question. I don't know if how the bread will be after 3 days. Groceries, I suppose that's a challenging one that it's an unknown at the minute. I would have my suspicions around groceries and grocery stores, etc. Like back when we were in full lockdown, we still had 50% community spread, even though everyone was at home for 7 weeks. And the only places that were opened were petrol stations and grocery stores. So, you know, I would be, they're probably right to be slightly concerned, but you know, you can't disinfect food. Mm-hmm. Again, that particular product, the Tersano product that I was talking about earlier, I'll check and see if that is safe to be used in that particular situation, and see if that's an option. There are products out there that are completely non-toxic. Again, that's a bit of a step too far, disinfecting food. Okay, very good. And I have 2 or 3 more. So craft groups, decision of, you know, which groups are using materials or doing creative workshops or passing around objects. What would be the concerns or the rules around that?
Again, I suppose making sure that you get the people that are going to be coming into the facility, they probably need to be risk assessed or questioned each time they come in. You know, there is no guidance around, there's no mandatory guidance around temperature checking and stuff at the minute. But again, if they were to do absolute best practice, they could temperature check people before they go into that environment. And obviously, if they're hand sanitizing, that eliminates a big element of risk as well when they're handling stuff. Probably a lot of the material and the stuff that they're handling are lower risk materials anyway. The higher risk stuff is obviously the plastic. That's the big concern around the built environment. But when they're doing arts and crafts and stuff, they're probably using cottons and papers and stuff like that, which are much less likely to hold the virus active for a very long period of time. But again, to eliminate the risk completely, you could go so far as to temperature check. Now again, like our grocery stores don't do it, so there's no legal requirement for anyone to do it except for nursing homes and residential care homes. But again, if you wanted to provide absolute protection, you could go that far. Yeah.
Thank you. Two more. One about no non-touch bins. Do they have to be a specific type of bin, or do bins with no lid that are emptied more regularly to cover that?
Swing bins you can use, as long as no touch bins are a bit of a challenge, because no touch bins tend to either be pedal operated, which are like, they're nearly as hard to get as hand sanitizer. They're impossible to get at the minute. Bins without lids are not ideal either, because obviously when things start to overflow, etc., people have to then pick up contaminated tissues and stuff and put back in. If it's a case that I'm trying to think, what is there a specific type of environment that they're in?
It's a community centre, so I suppose it probably would be the likes of water, the water machine where you get your glass of Ballygowan and dump the glass.
There are bins you can get, not necessarily the swing bins that have I'm not describing this very well, not the ones that have the angled lid, but the ones that have the flat lid, and prop them up on remove the lid and open the bin up and actually secure it to the top, so that there's a hole within there that they can put the stuff in, so it's not completely open, but they're not having to touch it either. I'm probably not describing that very well.
No, I get.
There are bins that you can get. Pedal bins would be ideal if you can get the foot pedal operated bins, but again, they are like hen's teeth at the minute. They're just not easy got.
I at that stage had 2 questions. I now have 3 because 2 more have come in, but I think, Margaret, we're going to have to start cutting questions here, so we'll run with these 3 if that's okay. The general public coming to visitor attractions, how do we contact trace them? Or what information do we need to gather if you're running a tourist attraction, for example?
Is that something that's going to be feasible in the shorter term, or when are they planning on opening?
I presume, they'll open later in the summer, probably in August, but this is probably a longer term problem, and that's
again, like you look at a retail store, like how long are they going to be in the space, for example, would be a question that you would ask. If they're not going to be in the space for any longer than an hour, is there an adequate social distancing in place? Is there adequate hand hygiene in place? All of that type of thing will have mitigated the risk anyway. You don't see grocery stores or retail outlets asking you to sign your name and address when you're going into shop. And I think a lot of our like tourist attractions and places like that, and hotels and bars and restaurants, they're not going to be required to do this either. So I don't think from that perspective it probably will be a requirement. It's to do with the risk that's posed to them by being in your facility. So if the risk is mitigated enough, or they're not in your facility long enough, then that would negate needing to keep that information. If it's a case that people are in there if they're in a facility and they're doing sports, for example, or they're like I've mentioned 5-a-side a few times, or they're doing dance class, etc., they're in a higher risk situation for a prolonged period of time, like an hour, with multiple other people in close contact. That's the kind of thing that you need to be maybe keeping a record of in that circumstance. But for that specific one, I don't think you would need to keep contact information or that then.
Okay. No, just that person came back to me just saying that the individuals will be on site for a few hours, and they're hoping to open in July. And knowing the centre that's in it, I hope they do manage to get open in July, it's a place to visit in good weather. The other 2 more questions that came in. One is related to a charity shop, and it's about frequency of cleaning the toilets and sinks that are available to staff and customers, I suppose, within that charity shop.
Okay. Is there any other toilet facilities that the public can use?
Been there? I don't think so. I think there may just be the one. So it's just.
Well, like what I'm saying is, I suppose, is it feasible for them to only allow staff access in there?
I think it would be. Yeah, that probably would be the option.
That would be the easiest way to solve that problem, is restrict it to staff only and clean it twice a day.
Okay, thank
if
you.
it's open to the public, it creates, I suppose, a frequency of cleaning that's higher than what the protocol requires. Yeah.
Okay, thank you. And the last one, and this is, I suppose, a mark of the social network or the social sort of abilities of the group. If groups are having tea and coffee and somebody bring biscuits or bring scones or something like that for sharing, can this all be admissible, or how do we deal with that?
I would never refuse a biscuit now.
Yeah, same as that.
Like, you know, this, I personally, if you're opening a packet there and then, that food is safe, it's sterile. You know, if it's a case that somebody's home baked, how well do you trust them? It's not something I would consider a problem. No, I personally would be happy to have a biscuit or a scone that somebody brought in. Where the liability sits, if somebody develops symptoms after that, you know, I think it'd be very difficult to prove it came from a scone or a packet of biscuits. You know, the proximity of the people in the room would be a higher concern. As long as everybody's socially distanced, eat to your heart's content.
Common sense must prevail.
Yes, yes.
And I think we'll leave it at that now, because I know there's we've gone way over the time, and I know some people have other commitments. But Annette, thank you very much. That was exceptionally good session, very interesting and very informative. Thank you very much.
No problem.
Just to say to everybody else as well that Annette is on board working with DLDC and the Donegal Volunteer Centre now as well, to support us, to support you opening up and, you know, going through the reopening process. So do please get in contact with us if you need that help, either in small group sessions or maybe one-to-one. But, you know, just Annette is very much working with us to support you to reopen. So that offer is there, and you can contact myself or John directly about that. As well as that, we will be issuing the cert of attendance. So if you haven't already put your name into the chat, and the organisation, do so before you leave, and just we'll get those out to you. And thank you very much again for your participation. It's definitely been very interesting, a lot of information there, frightening in one way, but very informative in another way.
That's always what I'm afraid of, that I scare the living daylights out of people.
Well, you did scare, but then you reassured, and it's
it's not, the one thing I would say is all of this stuff it's not difficult to navigate. It's just I've looked at the protocol in depth when it came out, and I was like, oh my God, it's hard for people to interpret that, to make it practical for their business, you know, because they use, I suppose, a method of communication that's a way up covering about 50 different sectors and industries, and it's hard to get it to mean what does it mean for me and my business. So yeah.
Annette, thank you very much. And as Margaret said, any groups that are looking for additional supports or additional advice or guidance or different topics that would like covered, you have both Margaret and I's email addresses. You know, let us know, give us a call. We'll try and arrange that. So no, thank you very much. Annette, could you hand me back the host, and I can start to deal with stuff then.
Perfect. Sorry.
Anybody who arrived late, I managed to not figure out how to set up them, so we could have two.
Next session is going to be
the host now. No bother.
It says, thank you very much, folks. I'm going to stop recording now.
Thanks so much.
Perfect. Thank you.